Since this episode's going to air in October, Breast Cancer Awareness Month, I just thought we'd start with what's been your why in breast cancer and your overall outlook on the disease, how far we've come, how much more we have to do, and what we can learn from the progress there that can help us with some of the other cancers that have been a little more recalcitrant.
I was there for this transformative decade in breast cancer. It's sort of hard to believe, but if you go from roughly 1988 to 1998, 1999, just over a decade, I think this is the order, but pretty much paclitaxel came to the clinic, GCSF came to the clinic, BRCA was identified and testing began, HER2 was identified and treatment began, oral aromatase inhibitors appeared, and the first conventional but oral chemotherapy drug, capecitabine, ended the decade. So that was a really exciting decade in breast cancer. And it played out in public health because, of course, the peak incidence of breast cancer death in the United States was about 1990. And it's been a pretty steady and steep decline from there. And that gets me to the question you asked, what can we learn from that? What I always found especially uplifting and exciting about the breast cancer world is it was a community, albeit a big one, a global one, but there was tremendous coordination both within the U.S. cooperative group system and beyond, so that the clinical trials were more often than not were coordinated, aligned, and they built in a series of steps, and they developed or tested principles as much as specifics. And I think that's the takeaway lesson that is relevant for today as well.